So we talked about lots of things that we should do. What are the things that you should not do? Like this little girl's waving a finger, don't do this. Yeah, don't smoke, don't drink alcohol. Excessive caffeine is also not advised, and of course, illicit drugs. Why shouldn't you smoke and drink? Well, of course, the drinking of alcohol can give rise to low birth weight and growth. There are heart and kidney problems. Babies can get brain damage, and particularly this thing called a fetal alcohol syndrome. With regard to smoking, this is associated with a greater risk of miscarriage, low birth weight, premature birth, and perinatal death. So please do try to not drink and not to smoke. What about cutting down on alcohol? Well, the thing is that we don't think that any amount is safe. So the current advice is not to have any alcohol during pregnancy where possible. Caffeine. So the advice from most of the professional bodies is that you should limit this to about 200 milligrams per day. And you think, ooh, how do I know how much is in the things that I like to drink? Coffee and tea are the two common types of drinks that contain caffeine. Of course, your cola drinks like Coca-Cola contain caffeine as well. So here are some indications. If you like to drink tea, then tea tends to have less caffeine per cup. So, usually up to about 50 milligrams of caffeine. Matcha, green tea, they contain caffeine as well. If you look at coffee, then approximately 1 cup of coffee is about 100 milligrams. So usually 2 cups of instant coffee is your limit of 200 milligrams per day. But of course, if you like Starbucks, there are different sizes of the drinks, and you'll see that some of the Starbucks drinks actually do exceed the 200 milligrams recommended amount in a single cup, especially if you go for the super-sized grande drinks. Now, earlier on this week, suddenly there was a bit of alarm, and no safe level of coffee drinking for pregnant women, study says. And so I had patients contacting me concerned that they had seen this in the news. And so a researcher in Iceland had published a research stating that there was no safe level of coffee drinking. But actually, if you look at it a little bit further, the evidence that he looked at, because it wasn't a new study, he was actually just reviewing old studies. And so the Royal College of ONG spokesperson had said that this study adds to the large body of evidence that supports limited caffeine intake, but pregnant women don't need to completely cut out caffeine as this paper suggests. So the RCOG advice is to continue limiting caffeine intake to 200 milligrams a day, or about 2 cups of instant coffee. So don't worry if you do need to have your coffee. 1 or 2 cups per day is absolutely fine.